you open big and wide for me?
The Seattle Urgent Care Clinic adds to children's other options for emergency and urgent care, an urgent care clinic in Bellevue, and an emergency room at the main hospital. With these various options available comes the question, when should you take your child to the urgent care clinic versus the emergency room? Let's ask Dr. Josh Weldon of Seattle Children's Urgent Care for some guidance.
I think the main thing to think about is if you think it's clear that your child is very, very ill and may need to be admitted to the hospital or have a procedure done that's going to require subspecialty care, that you should probably go to the main emergency department. For more kind of minor complaints, a lot of the cough and cold complaints and sore throats and ear, does my child have an ear infection? That's something we're very capable of dealing with here.
Let's start with A for allergy attack.
If your child has respiratory symptoms as a result of an allergy, like they have a known nut allergy and they're having trouble breathing, that's 911 or straight to the emergency department. If your child has a rash and you're not totally sure why, it's certainly something we can evaluate.
How about asthma?
Also depends a little on severity. We'll usually initiate that treatment here, but if it's clear that they're fairly sick and might need to be admitted, then we'll transfer them to the main ED.
B is for broken bone. Most can be handled at the Seattle Children's Urgent Care Clinics, but any fracture where there is visible deformity should be handled at the emergency room.
If your child broke their arm and it's sticking out of its skin, hopefully nobody wants that to happen, but if that happens, you need to go to the main emergency department.
Minor burns, dehydration, diarrhea, all common reasons for urgent care visits. Same with E and F, ear infections, and fever. H is for head injury.
A patient who hit their head and had a very brief or no loss of consciousness is a patient that we're happy to evaluate here. So patients with severe head injuries who are not back to their neurologic baseline or clearly have significant head injuries need to be seen in the emergency department.
Stitches, sprains, and strains, all common reasons for urgent care visits. There's an entire alphabet of reasons your child may need to see a doctor when their own isn't available. If it's life-threatening, call 911. For minor illnesses and injuries, though, Seattle Children's Urgent Care Clinics are often the perfect fit.